Hi everyone, this is Anna Maria with Henschel Chiropractic. I'm going to talk a little bit about sciatica, about sciatic pain today. So that can be a very complicated issue, and I'm not even going to touch on this is only going to be a fraction, right? Definitely come in to the office, get evaluated by one of the doctors to move forward, right, if you are experiencing sciatic pain. But if you've already done that and you're just looking for some stretches that can help relieve some of the sensation that you're having, that's what we're doing here today. So generally what happens, right, when we're experiencing sciatic pain, that there's a squeezing, there's an issue of the sciatic nerve that starts here right at your sacrum on your spine and actually travels all the way down. So sometimes you're feeling that zinging going down the back. And simply opening up these, finding a stretch on your low back muscles can help provide some relief for that. There are other components as well, right? So when you're, sometimes you're experiencing that squeezing and there's tension because your core isn't doing its job, right? Your transverse abdominis, those muscles, that deep corset that support your spine, isn't engaging and creating enough space, right? And that's a separate issue, right? Your glutes often need to be strengthened because sometimes people don't realize they are the biggest muscle of your core, right? It's not just your six pack. So you need to attend to that as well. But things that people with sciatica, no, let me change that. Things that everybody everywhere should be doing every single day consists of stretches like these. And you can do this even before you get out of bed, right? When you first wake up, right? I'm gonna pretend, look, I just woke up. And I knocked over my foam roller because I know you guys all sleep with a foam roller next to your bed. All right, you're gonna bring I've got my right knee in, and I'm gonna pull it in. And if it doesn't feel great to lengthen that other leg, don't. Keep a soft bend, right? But you're gonna pull it in. We're gonna start to find a little bit of rock and roll left and right? Getting a little bit of love into that hip joint, that pelvis, making some space there in your low back. And then let your right leg go. We'll find the other side, pulling it in. I'm a big fan of finding movement within stretches. I think sometimes we think that we hit a stretch and we got to stick it like a statue, but really it's just as beneficial, if not a little bit more beneficial, just find some gentle movement within the stretched position. And then we'll bring in both knees. It's like giving yourself a little bit of a massage, rocking a little bit left and right. And then I'll send my left foot here down to the mat. I'm gonna cross that right ankle over the left knee and reach through here, finding a figure four stretch. So you can interlace your hands, right? And if you're not that mobile yet, you can grab a strap or a belt and loop it around your left thigh and pull your legs in this way, okay? If you have a little bit more mobility, you can reach all the way and interlace your hands on the front of your left shin. Now you're gonna feel this a lot, right, in your right glute and your right piriformis, right? Which is a good thing because they are often culprits in causing low back pain. And then we'll switch sides. Pull your legs in any amount, finding a little rock left and right. And then we'll release both legs down and make sure you pull legs in together. After you work with one leg at a time, we'll pull both legs in together. Or you can rock and roll up to a seat and come into a tabletop position. And we'll move through a few rounds of cat and cow, right? So this is spinal extension here. I'm gonna lift that tail, I'm gonna lift my chin. And as I exhale, I'm gonna come into spinal flexion, trying to round the spine. Push through your hands, belly button in. And take a few rounds of here, maybe 5 or 10 to start your day. Now, real important, sometimes I'll see patients doing cat and cow and they're really just doing this, right, with their head. I would even rather that don't worry about anything waist up, right? If it's helpful for you to just bring your attention to what's happening below your waist, it's the pelvic movement that we really want to see, right? It's that anterior tilt and your posterior tilt of your pelvis that's going to help you engage that transverse abdominis. It's going to help protect your spine throughout the course of your day. All right, everyone, I hope this helps. Of course, if you have any questions, give us a call at the clinic, make an appointment, get an adjustment. We're always available to you. Hope to see you soon.